Hello friends, welcome to Knowledge Bytes. Friends, today we are going to study an important topic which is local anesthetics. In local anesthetics, we will see the mechanism of action of local anesthetics. Then we will classify the drugs of local anesthetics. Then we will see what happens when we add adrenaline to local anesthetics. And lastly, we will see that systemic toxicity due to local anesthetics. So starting with mechanism of action of local anesthetics. Friends, I believe that we all know how action potentials are generated and how nerve conduction occurs. So I am just writing only the steps of how action potentials are generated. Firstly, depolarization will occur. Because of depolarization, after depolarization, repolarization will occur. The continuous depolarization and repolarization leads to generation of action potential, and then sensory nerve conduction will occur, and we have to block this sensory nerve conduction. The function of local anesthetics is that it blocks the function of sensory nerve conduction. The question is how it blocks the sensory nerve conduction. It blocks the sensory nerve conduction just by blocking the depolarization. That is the first step. Now just look upon here. This is axonal membrane, and inside the axonal membrane, axon plasm is present. On the axonal membrane, sodium voltage gated channel is present, and the voltage gated channel opens when the desired voltage is obtained. Here the nerve is in active state. When the nerve is in active state, then only the sodium voltage gated channel is opened and the influx of sodium is happening. When the sodium influx is happening, when the desired sodium is now, the desired concentration of sodium is now reached in the axon plasm, then only depolarization is occurring. And we all know that the ultimate thing which happens is the sensory nerve conduction, and in local anesthetics we have to block this sensory nerve conduction, and I have told you that we can block this sensory nerve conduction just by blocking this first step, that is the depolarization. Now we will see the function of local anesthetics. Suppose AB local anesthetics we are giving. Before giving, I just want to tell you all what is the nature of this local anesthetics. This local anesthetic is non-ionic. It is basic in nature. Also, we add sodium bicarbonate to local anesthetics. Now question is why we add this sodium bicarbonate, that is baking soda, to local anesthetics. Because of two reasons. First reason is it increases the permeability of local anesthetics to cross the membrane. So now local anesthetics will be easily come inside the axonal membrane, and because of when it comes easily inside the axonal membrane, the onset of action of local anesthetics will increase. There will be faster activity of local anesthetics. Now just see here. Now this local anesthetics, which is basic in nature, when it crosses the membrane, it gets ionized. Why it is getting ionized? Because local anesthetic is in basic in nature, and axon plasm, it is acidic in nature. When it gets ionized, the ionized part of local anesthetics just binds to the inside of the sodium voltage gated channel, and when it binds to the inside of the sodium voltage gated channel, it just blocks the sodium voltage gated channel and hence inhibit the entry of sodium entering into the axon plasma. Because of that, depolarization is not occurring, and hence sensory nerve conduction is not occurring. Therefore we get the function of local anesthetics. So this is the mechanism of action of local anesthetics. Now the examiner is interested to ask few questions. The question is, what will happen if we give local anesthetics to the nerve which is in resting stage. First question he will ask this, and the second question which he is interested to ask, what will happen to the local anesthetics when we give what will happen to the what will happen when we give local anesthetics to repeatedly stimulated nerve which is repeatedly stimulated. Now when the nerve is in resting stage, then the membrane of the nerve will have resting membrane potential, and when the nerve is having resting membrane potential, then each and every voltage gated channel is closed. Voltage gated channel is closed. When the voltage gated channel is closed, then there will be no influx of sodium, then therefore no depolarization. And we all know that the local anesthetics act on the activated sodium voltage gated channel, but here since the voltage gated channel is closed, then there will be no role of local anesthetics when the nerve is in resting stage. And the second thing applied to this also, repeated nerve stimulation, here also there will be no role of local anesthetics, because these two are not conducting any impulse, no impulse conduction. I think I am clear to you all. Now we will see the classification of drugs. In classification of drugs of local anesthetics, there are two groups, ester and amide. Ester group of drugs are cocaine, procaine, chloroprocaine, benzocaine, tetracaine. And in amide group of drugs are lignocaine, prilocaine, bupivacaine, editocaine, mepivacaine, ropivacaine. You can see in local anesthetic drugs, cane are present everywhere. Cane. Either it is ester or it is amide. Everywhere cane is present. When you see this last cane, then you can say that they are the local anesthetics. Now how to differentiate ester from amide? In ester, you will see only one alphabet I is present. Only one alphabet I. Everywhere only one alphabet I is present. And in amide, two alphabet I is present. One is this and the other is this one. Two alphabet I is present. Ester group of drugs, they are short acting. Amide group of drugs, they are long acting. Ester group of drugs are metabolized by pseudocholinesterase. Whereas amide group of drugs, they are metabolized in liver by cytochrome. Pseudocholinesterase are present in axon plasm, but one exception is there in ester group of drugs, that is cocaine. They are the first local anesthetics and it is metabolized in liver. Okay, now chloroprocaine, it is contraindicated in spinal anesthesia. It causes paraplegia. Bupivacaine is most cardiotoxic. Tetracaine, its application is in topical application such as eye. Benzocaine and prilocaine. Benzocaine and prilocaine, they causes methemoglobinemia. Now I want to tell you about the different types of nerve fibers. The different types of nerve fibers, they are A alpha, A beta, A gamma, A delta, B and C. They are the different nerve fibers. Local anesthetics action on the nerve fiber. Firstly, they will act upon C, then B, then A delta, then A gamma is equals to A beta, and last action will be on A alpha. Now I want to tell you what is the role of adrenaline when it is added to local anesthetics. Role of adrenaline when it is added to local anesthetics. There is two function of adrenaline when it is added to local anesthetics. Adrenaline is systemic sympathetic neurotransmitter. So since it is sympathetic neurotransmitter, it just constricts the blood vessels. Because of the constriction of blood vessels, it localizes the drug to the desired site, therefore increase in duration of action of drug plus better intensity of drug. Since blood vessels are constricted, because of that less amount of drug will reach in systemic circulation, therefore it reduces drug toxicity. It reduces drug toxicity, it reduces systemic toxicity. But one thing more I want to tell you about this systemic toxicity. Epinephrine, it stimulates the beta 2 receptor of skeletal muscle. So because it stimulates the beta 2 receptor of skeletal muscle, the blood vessel beds which is present in the skeletal muscle, they gets dilated, and when they get dilated, the local anesthetics reach in the muscle and they are deposited in the muscle. So from there they can cause the systemic toxicity. Now what is the contraindication of adrenaline, at where we should not use adrenaline plus local anesthetics? Contraindication of adrenaline in local anesthetics: it should not be used in digital block such as in finger, toes, because at these places ind arteries are present. When ind arteries get constricted, because of that ischemia can occur, and ultimately ischemia can lead to necrosis. Now I want to discuss you about the side effects of local anesthetics. Local anesthetics interfere with the function of all organs. Okay, it interferes with the functions of all organs. More the concentration, more will the systemic toxicity. Therefore more the concentration is directly proportional to the side effect of local anesthetics in systemic toxicity. Now the side effects of local anesthetics in CNS, central nervous system. We all know that the fundamental structure of central nervous system is neuron. When these neurons are blocked, then brain will be depressed. When the brain will depressed, then it will progress to clonic convulsion. Seizures can occur. So the drug of choice to prevent and arrest clonic convulsion, the drug of choice is benzodiazepines. Propofols and barbiturates can also be used, but they increases the cardiovascular depression. Therefore, benzodiazepines are the drug of choice to prevent and arrest clonic convulsions. Now we will see the side effect in central nervous system. Local anesthetics act primarily on myocardium. When it acts on myocardium, it decreases electrical excitability. Therefore, it decreases the rate of conduction. Therefore, force of contraction will decrease. Blood pressure will decrease. Rarely cardiovascular collapse occur. Due to local anesthetics, and because of that death can occur. Now there are few local anesthetics which are used in anti-arrhythmicity. So they are the anti-arrhythmic drug. They are the class 1 anti-arrhythmic drug. Class 1A anti-arrhythmic drugs. They are the lignocaine and they are the procainamide. So now here I have completed with the pharmacological aspects of local anesthetics. Thank you.